As an addiction physician, I need more tools in my toolkit because for some patients, they fail conventional medical therapies. And of course, I'm going to use an evidence-based approach and a stepwise approach to treating my patients with chronic diseases. And if I get to a place where I need to use a drug that is somewhat toxic, but the benefits outweigh the risks, then I'm going to use that medication based on evidence. It seems like there's a political culture and a political climate in Canada for people to be like, we need to stay away from heroin because heroin is illegal. Heroin is legal for treating addiction in Switzerland, Denmark, the UK, Germany, the Netherlands. They're looking at it, I think, in Belgium right now too. And the evidence shows that it's very effective at treating patients that don't respond well to other medical therapies that we have. The gold standard for opiate addiction treatment right now is a medication called methadone. Methadone is in the same class of drug as morphine, as OxyContin, and as heroin. There's a huge body of literature to support that methadone is very effective at treating opiate addiction, but it doesn't work for everybody. There is a cultural opposition to heroin, but it's exactly the same drug. Heroin is a trade name for a medication called diacetylmorphine. The active form of diacetylmorphine is actually morphine. I can prescribe morphine to anybody, but I'm not allowed to prescribe heroin as a therapy to my patients with heroin addiction. There seems to be no rhyme or reason to why heroin is illegal and why other opioid medications are currently legal for prescription. It doesn't make any sense. One of the main criticisms I always hear is that you can't give heroin addicts heroin, you're just feeding their addiction. And the answer I have to that is, I'm not feeding their addiction, I'm treating their addiction. By prescribing heroin to a heroin addict, if I'm able to eliminate crime, if we're able to eliminate human suffering, if we're able to eliminate all the expensive healthcare costs associated with illicit heroin use, then we've achieved our objective of treating their addiction. It's so obvious to me that heroin-assisted therapy is beneficial for many patients, it's beneficial for society, and it benefits everybody.